Hello and welcome. Thank you for joining us today. This is the Master Plan for Aging System Change Symposium, Part 2. This is our non-Medi-Cal Home and Community-Based Services, or HCBS. You'll be hearing that a lot today. HCBS Home and Community-Based Services Gap Analysis. And today is the last day of July, July 31st, 2025. So let's go to the next slide. I am Carol DeAndres. I am the manager of the Master Plan for Aging, or MPA, Stakeholder Engagement Manager here at the California Department of Aging, or CDA, and I'm happy to be with you today. Next slide. Want to point out our accessibility features for this webinar. We do have American Sign Language interpreting provided, and we have Bailey and Summer, and we thank them for being with us today. We have closed captioning. You should have that available to you through your Zoom webinar functions. This availability is at the bottom of my Zoom toolbar, the CC Show Captions, and View Transcript. So feel free to enable that if you'd like. And if your CC icon does not appear, check under the More, which are the three dots, and sometimes that function is under there. Next slide. The chat function is enabled for panelists, CDA staff, and our guests to share out meeting-related resources and information. The question and answer function is enabled for our public attendees, and we will work to respond to your questions during the presentation, or we'll provide you a written response in the Q&A. So feel free to use that. And we will endeavor to get a response back to you, either orally or written. Next slide. Today's recording will be posted on our YouTube channel. We'll put that link in the chat. Our meeting slides, transcript, and recording will also be posted to the HCBS Gap Analysis and Multi-Year Roadmap webpage. That's a long name, but that's our webpage that's devoted to this body of work. And if you have any additional comments or questions, they can be directed to our email address, which is hcbsgapanalysis@aging.ca.gov. Next slide. And I will spotlight the director of the California Department of Aging, Susan DeMorris, to get us going. Hello, Susan.
Hi, Carol. Thank you. And welcome to everyone joining us. Welcome back to any of you who joined us earlier today for our LTSS financing webinar. What brought us here today? Why are we all on a Zoom together to learn about this? I want to thank our governor, Gavin Newsom, who launched California's groundbreaking nation-leading master plan for aging in January of 2021. This is all part of our 10-year blueprint for the state of California. I want to thank the legislature, together with the governor, that made funding available to do this research and to explore these topics. I want to thank our Secretary of Health and Human Services, Kim Johnson, who fosters collaboration across departments and agencies. And you'll see today that's demonstrated because the LTSS HCBS, Long-Term Services and Support, Home and Community-Based Services Continuum, is both deep and wide, and it involves many state departments, and it's a partnership between local, state, and federal government. So you'll see that play out in today's presentation. I also want to thank Sarah Steenhausen with the Department of Aging and her team in the Division of Policy, Research, and Engagement, who have been leading this work with our consultant partners, who you'll hear from today. So we're very excited to be sharing this information with all of you today, to take your questions and comments, and to continue the conversation. This is not a culminating webinar, it's a kickoff webinar. So you'll be hearing lots more on this topic in years to come as we move into year 6 of the Master Plan for Aging and we approach the midpoint of our 10-year blueprint. So thank you once again, everyone, for joining. And I'll now turn it over to Sarah.
Great. Thank you so much, Susan. I really appreciate the introduction. And we're really looking forward to releasing our home and community-based services gap analysis, which of course you have in the chat, but then also talking about another tool that has been developed by our partners at Mathematica, a digital landscape tool that you will have access to at the conclusion of this webinar and that we will walk through today. So next slide, please. And you can move to the next slide. Right now, we are going to walk through a bit about the context for this initiative and then the overview of the findings from the home and community-based services gap analysis. Of course, precipitating the need for a master plan for aging is that, as we all know, California's population is rapidly aging. And what's really unbelievable to see is that when you look at the percent change between 2020 and 2040, those years, our aging population, the population over 65, is dramatically increasing upwards to almost 140% compared to our youth population, which is actually decreasing. So we see that this has tremendous implications for service delivery, for financing, for workforce, and we have to think about how people can access home and community-based services across the continuum that meet their needs. Next slide, please. So with that, as Susan noted, we're so grateful for Governor Newsom's leadership that led to the development and launch of the Master Plan for Aging in January of 2021 through a whole of government, whole of society approach to planning for the aging of our population through these 5 bold goals that address housing and transportation and community living, how we reimagine our healthcare service delivery system, how we focus on inclusion and equity, not isolation, focusing on our caregiving workforce that is so critical to providing the both paid and unpaid caregiver support to our loved ones in their home and in the community. And then finally, this issue of how we afford the aging as we age and how we pay for what we need, including our long-term services and supports. Next slide, please. So when we think about the long-term services and support system, first, it's just important to call out that long-term services and supports refers to the non-medical functional support that people may need, including assistance with activities of daily living, such as eating, bathing, dressing, transferring, or mobility, as well as instrumental activities of daily living, such as shopping or meal prep or financial management. These services can be provided by paid or unpaid caregivers in the home, community, or institutional settings. So with that framework, we looked across the 5 bold goals of the Master Plan for Aging, and we saw a number, like a real through line of how we're really going to focus on transforming our long-term services and support system and really make meaningful change through the Master Plan for Aging. So, with a lot of stakeholder input and considerations, with the way that we really define it is in these 4 quadrants of long-term services and support system change. Each of these are necessary to address and resolve in order to make our system age-friendly and disability-friendly to ensure that people can age with dignity and independence. So first is navigation, and this really gets at how people are able to find the information and support that they need to access the services that they need as they age or acquire a disability. So this is what we often refer to as our no wrong door system, so that you can get the information you need to make informed choices on very quickly and seamlessly. Unfortunately, we have a very fragmented system. We are trying to streamline access to information, and this is where a lot of our no wrong door system work comes into play under the Master Plan for Aging. Second is access, and this is the focus of our conversation today. Access has to do with where services are available and what services are available throughout the state to ensure that people actually they might find the information they need, but are the services there that they need in the home, in the community? And so this is the basis of our discussion today. Third is workforce. So even if we have a much more navigable system that has great access to services, we have to ensure that we have a very high quality workforce to meet the needs of all of those aging and disability partners, as well as caregivers, family caregivers. And finally, financing. How do we finance the system, and how can we ensure that people don't have to impoverish themselves, and that the state and federal government can effectively finance and serve people in the home and the community without the population having to impoverish themselves? That was the conversation we just had earlier today. And today's conversation right now is going to focus on home and community-based services access. Next slide, please. So we were really fortunate in the 2022 state budget to get a $4 million investment through our state general fund to do an analysis of home and community-based services in the non-Medi-Cal system. So the Department of Healthcare Services has released a gap analysis of the Medi-Cal home and community-based services, but we recognize that really people don't access services primarily just in the Medi-Cal arena. Many people either access both range of services, or some people can't access Medi-Cal and they rely on non-Medi-Cal home and community-based services. So we focused this project to develop an inventory of what are all of the non-Medi-Cal home and community-based services that are delivered through the state in California. And then build on the Medi-Cal gap analysis to develop our own gap analysis of these non-Medi-Cal home and community-based services in California. And then the second part, and the work that we will embark upon over the next year and a half, is development of a roadmap that over many years can help us achieve true access in the non-Medi-Cal home and community-based services. So this is essentially the first part of our process, where from here, we have to build out the roadmap. Next slide, please. So we were really fortunate to work with contract with Mathematica Consultancy. They also led the Medi-Cal home and community-based services gap analysis, and they were able to do really comprehensive research on the needs of this population, on the services available in the community, using publicly available data, key informant interviews, as well as other desktop research that they were able to access. When we worked with Mathematica, the way that we think about the landscape of non-Medi-Cal providers, it primarily includes services provided through area agencies on aging, which includes Older Americans Act funded services, adult day health care and adult day programs, aging and disability resource connections, caregiver resource centers and the services they provide, as well as services provided through independent living centers, and then finally regional centers. I also want to note that in addition to this, we included housing and transportation, as well as all of these services, because we recognize that we needed to understand access to affordable, accessible housing and transportation for older adults and people with disabilities in order to truly understand where the gaps in the system are. Because if you don't have housing or transportation, it really doesn't mean much to have access to services in the community. So this was primarily the landscape that we worked with. And if you go to the next slide, we realized that we needed to think of this, communicate this in a way that made more sense rather than thinking about it from a program perspective. We wanted to think about an inventory of the services and how would we really define gaps in the system. So we developed an inventory using some of the approaches that 211 has developed. We have divided services by caregiver supports, communication, information, and referral services, health services and community supports, housing, safety, social inclusion, economic security and employment, and then finally, as I said, transportation. So when you open the report, you will see that the analysis really looks at these types of services across the different programs that I just outlined. I do want to note that there are some instances where programs are both funded through Medi-Cal and non-Medi-Cal. One example being adult day healthcare, which is called the community-based adult services program, as well as regional center services. Those are provided through the Department of Developmental Services, but they do have a Medi-Cal waiver. But the data that we analyzed for this report was based on their non-Medi-Cal data operated through the regional centers. So that gives you a very high level overview of the range of services and programs that were included in this analysis. I will also put up a link to the Department of Healthcare Services Medi-Cal Home and Community-Based Services, so you can see how the two complement one another. And at this point, I'm going to turn it over to my colleague, Anna Acton, who is a Deputy Director of our Division of Policy, Research, and Engagement at the Department of Aging and has been an amazing partner who has helped lead this work and is going to present the high-level findings of our gap analysis that Mathematica conducted. Anna, I'm turning it over to you.
Thank you so much, Sarah. And thank you for setting it up. It's really exciting to be at this point where we're able to go over some key overall findings of the HCBS Gap Analysis, the non-Medi-Cal HCBS Gap Analysis. And I'm going to do some overall findings, and then I'm going to talk a little bit about some high-level findings in the gap analysis for both transportation and housing. So it's been a great process working with Mathematica, the other state departments, and the CDA team to get to the point where we were able to release the gap analysis. I know the link has been put in the chat for you to look at. So please, we're going to go high level here, but please take the opportunity to look at the report in its entirety and review it for yourself. So to begin with, again, Mathematica did desk research, looked at available data from different programs, and then did interviews with multiple state departments and with organizations serving older adults, people with disabilities, and caregivers. So to go over some of the overall findings, I want to start with just saying that there are certain groups that have greater social needs and face additional barriers to accessing HCBS. And in general, what you'll see with the report is older adults living in rural regions of the state who consistently face barriers to accessing all types of HCBS that we examined. Counties and rural areas have fewer services available, fewer providers, and lower utilization rates compared to more urban counties. The lower use of HCBS in rural areas is primarily related to the shortage of providers and the long distances that people must travel to receive services. Several providers that we interviewed noted concerns among rural residents about the importance of confidentiality in smaller communities, pointing to a need to really build relationships with consumers and other providers and really establish trust. We also saw that older adults and people with disabilities who do not speak English as their primary language disproportionately face barriers in finding available services, applying for services, and receiving services in culturally and linguistically appropriate manners. We also saw that Black and Hispanic older adults and people with disabilities often face barriers to accessing services and expressed apprehension about doing so due to mistrust and concerns with perceived stigma. We also saw individuals that require more complex care, including those with advanced dementia or other cognitive disabilities, might often lack disability-specific resources and supports. So we really saw an awareness gap here is one of the ones that I want to start with highlighting. Providers and family caregivers highlighted a lack of awareness about which services even exist and how to access them. Across the board, older adults and people with disabilities and their caregivers often face difficulty accessing HCBS because they do not know about available services, and they don't know about varying eligibility criteria for those services. The awareness gap is particularly acute in the rural areas, as I mentioned, where information and internet might also be limited. We hear this time and time again, but really a challenge with navigating the system. The network of programs and providers is challenging to navigate, which creates confusion and delays in accessing needed care. Multiple HCBS providers offer similar services, which causes confusion over which entity is responsible for supplying those services. Several HCBS providers noted that different programs offering housing referrals or transportation, for example. There's multiple entities that offer those services, but there's not enough coordination among those entities to avoid duplication or to use shared resources or knowledge to better address the individual's needs. We also heard about concerns about sharing personal information, such as immigration status, coupled with feelings of distrust, for government-affiliated entities that may also prevent older adults, people with disabilities, or caregivers from seeking services and supports. Multiple providers and consumers from traditionally underrepresented communities, such as individuals from Black, Latino, tribal communities, Asian Pacific Islanders, and LGBTQ plus communities, really highlighted barriers to HCBS access based on anticipation of discrimination and non-culturally competent care within healthcare and the social services realm. Some interviewees noted a preference among consumers from traditionally underrepresented communities to receive support and information from trusted community partners or organizations that are embedded within those communities. And in many cases, these trusted community organizations don't have the capacity or resources to provide the necessary services. We also saw issues around funding and just resource capacity. Nearly all HCBS providers cited limited funding as the primary driver of gaps in HCBS access and availability. Funding and reimbursement rates for HCBS have not increased proportionally with inflation and the cost of living, as well as the cost of providing services. And then meanwhile, providers noted that demands for their services has grown with the aging population that's also growing, at the same time that state agencies expect more data and reporting as part of their oversight role. We also heard about wait lists. People in need of services may find themselves placed on waiting lists because of limited provider resources, which creates a delay in accessing the needed care. When individuals reach the top of the list, they may no longer be eligible, or the services may no longer be appropriate for their level of needs at the time that they can access those services. Multiple HCBS providers noted that individuals who are placed on waiting lists may be reluctant to seek out other services. This turns into really what I would call a culture of denial, in which people anticipate being denied services. So they choose not even to reach out and seek services at all. And then lastly, data challenges. We saw that inconsistent approaches to data reporting contribute to an incomplete understanding of the number of people being served and what type of services they're even accessing. And we saw inconsistency with the demographic characteristics that are reported, and also with really identifying the locations of where individuals are getting services. The state departments that oversee these programs shared with Mathematica as data was available to help identify the utilization trends and gaps. However, other departments, including like the Department of Veterans Affairs and Department of Transportation, were not able to share utilization data because the local service providers report data to maybe the federal government rather than a state agency, or because departments do not have the ability to extract data from their internal systems. And I'll go to the next slide. So I wanted to highlight and focus some key findings that we found around transportation. So in this analysis, Mathematica assessed transportation services for older adults and people with disabilities through paratransit services, looking 2 at transportation coordination, and then 3 looking at grants, vouchers, and supplemental transportation programs that were available. They analyzed transportation coordination through our area agencies on aging, our regional centers, and our independent living centers. And they looked at paratransit, including dial-a-ride services. They also looked at grants and vouchers such as the Area Agency on Aging Supportive Services for Transportation. We looked at the 5310 grant programs, federal grant programs to enhance mobility for seniors and people with disabilities. And they also looked at regional center transportation systems. So with some of the findings here I want to highlight are that each county has a different transportation service delivery system. If you've seen one county, you've seen one county. This variation impacts the structure, administration, and utilization of these services. Within and across counties, there is often a lack of coordination of these services, leading to a fragmented and confusing transportation system for users. I also want to note that interviewees cited numerous challenges with accessing and using public paratransit services, including lengthy and burdensome transfer trips, high fees, lack of same-day service trips, and variable eligibility criteria. We also heard about driver training. Interviewees noted that drivers are not trained on how to support riders who are living with certain kinds of disabilities, such as dementia, or who may exhibit behavioral or psychological symptoms because of their disability. We also heard about issues related to coordination, including in rural areas. We heard that there's not enough accessible and coordinated transportation service providers, especially again in those rural regions of the state and regions with lower incomes as well. Individuals that we interviewed noted that older adults with lower incomes are more likely than older adults with higher incomes to require transportation services, which may also disadvantage older adults in rural areas or with areas with less access to these transportation services. And then data, again, the lack of data on accessible transportation services for older adults and people with disabilities makes it difficult for policy work, for planning agencies, and other providers to identify and address gaps in services. So all of this really points to specific gaps in transportation services. And so I'd like to highlight just gaps around transportation coordination in general. We saw low utilization and funding for things like mobility management for individuals, but also for coordination across these different transportation systems. We saw gaps in grants, vouchers, and supplemental transportation services around a lack of accessible, coordinated transportation service providers in general. And then, of course, that being more pronounced in the rural communities. The gaps in paratransit services were really around those transfer trips being lengthy and burdensome. The eligibility determination can be challenging, including across counties and across jurisdictions. The need for the lack of same-day trip options for those that need to make less planned trips or who may be employed and need transportation to employment. We heard often that paratransit is more concentrated in the urban areas, and then the cost barriers for individuals that pay for these services being difficult. Okay, we'll go to the next one. I want to go over some key findings and gaps around housing. So Mathematica assessed housing services for specifically older adults and people with disabilities by looking at housing supply in the state of California, housing financial support, support for people experiencing or at risk of homelessness, home repair and modification programs, and other housing-related services for this target population. We found that housing affordability is the #1 issue facing older adults and people with disabilities. We saw that in Los Angeles and Orange counties, they have the greatest shortage of affordable housing units, whereas in San Diego and San Benito have the longest wait times for affordable housing units. older adults and people with disabilities actually occupy most of the affordable housing units. And it's important to note, they comprise at least half of the population experiencing homelessness. Yet neither the physical infrastructure for housing nor the process of accessing affordable housing or homelessness services are designed to meet their specific needs. Interviewees noted that people with physical disabilities, people with significant behavioral health, cognitive or intellectual disabilities, and people with more than one disability struggle to find housing the most. We also found, and I'll also note that that included needing assistance and support with completing affordable housing application process and having support to do so. We also saw that affordable housing providers struggle to link individuals, older adults, people with disabilities to a variety of supportive services, and that those supportive services are critical to helping people not just find housing, but maintain that housing. And that largely this was due to a lack of funding and coordination between those housing providers and those organizations that can provide those supportive services. So the gaps really point to the need for the availability of more affordable and accessible housing, coordination of housing and homelessness services for older adults and people with disabilities, and especially those that are at risk of homelessness or who are experiencing homelessness. We saw a lack of culturally responsive housing services, especially for those with physical disabilities specifically, or those with limited English proficiency. We saw a lack of supportive services really to support people to navigate housing, including finding housing, but then also maintaining stable housing. And then we saw a need for funding for housing infrastructure, for navigation and supportive services, especially tailored to the needs of this target population. So we've went over some high-level findings of how we got here around the non-Medi-Cal HCBS Gap Analysis. And what I want to do is actually turn it over to Chris Lindman, who's the lead data visualization and design developer for Mathematica, to review the HCBS digital landscape tool. So part of our work was not only developing our report that's now available on our website, but also looking to see how we could develop an online digital tool that actually combines Department of Healthcare Services, Medi-Cal HCBS information through the work they did with their gap analysis and the non-Medi-Cal HCBS gap analysis work together to provide a tool for stakeholders, for local planners, for policymakers in identifying services, but really looking to see how we can identify the gaps in services and to help address some of those gaps. So with that, I'm going to turn it over to Chris to walk us through this new digital tool that we've been working on.
Thank you, and hello, everyone. My name is Chris, and I'm with Mathematica, and I'm excited to share this digital tool with you today that we've created. And so bear with me as I share my screen so you can all follow along with me. All right, so this is the web page where the tool lives. And as you can see, it's called the Landscape of California's Home and Community-Based Services. I think the first sentence describes the purpose of the tool well, but the entire introductory text here is useful as well. I'll just read the first sentence. It says this tool aggregates key data points and presents the landscape of specified home and community-based services available in each California county. So as that implies, this tool is really focused on counties, in particular one county at a time. So the decision we need to make on this landing screen is, as prompted here in this dropdown, to select a specific county. So if we open that up, we are provided with a list of all counties throughout the state of California. So I'm going to start first by providing just an overview of the tool. So just as an example, I'll select Sacramento County, but the content remains the same. Regardless of county, the data just updates to be focused on the selected county. So as we select Sacramento County, you can see that The content below has started to populate, and as we scroll through the page, we will see the various subjects that are covered, as well as different data points throughout the tool. We can just scroll down, and what you'll notice is that the content is divided into these discrete sections, each of which contains some introductory text, explains the content, in this case, spoken language, as well as a chart visualizing the data that this section focuses on. At the bottom of each section, you'll also find some information about the data source, as well as any notes on the content. And also in each section, you'll find a toggle up here that changes the view from a chart that visualizes the data or a tabular format for a table view. So I'll do that now just to demonstrate that that reveals the same data in table views. I'll switch back to the chart for the rest of this demonstration. And finally, on the left-hand side, we can find the table of contents, which outlines each of these sections and groups them into these categories of demographics, programs and providers, and also service utilization. And this can be used as a way to navigate throughout the page as well as scrolling. So, for example, if we wish to take a closer look at home delivered meals right now, we could click on that and we're automatically scrolled down to the home delivered meals section. So that's a quick overview, but let's go through each section briefly to describe what the content available is. So I'm going to go back to the first section, which is age, identified here. So here we can see that there's a chart showing various age groups. The selected county, again, Sacramento, is identified in the blue color. And then we've also provided the statewide values in the orange bars. You can see the distribution of age groups throughout Sacramento County, as well as the state. Next section is race and ethnicity, which covers a similar breakdown in total of the race and ethnicities in Sacramento County on the right-hand side of the chart here. And on this skinnier bar on the left-hand side is the statewide proportions for comparison. And just as an example, you can hover over a specific category, in this case, Asian, non-Hispanic, to see what the actual proportions are for both the county and the state. And also, I should point out here that throughout the tool, you will see some interfaces on this right-hand column that allow you to filter the data to a subgroup. In this case, you can select a specific age group. If we change to the 85 and older population, the chart and the data within it will update to that specific population. But I'll switch back to the total group for now. Next section is spoken language. It has a very similar distribution showing the proportion of primary language spoken in the county and state. And below here, we see the percent who speak English less than very well. And on the right of that, we see of those who speak English less than very well, what is their primary language. Next section is Medi-Cal funded programs and services. And at the front of this section, you'll have a variety of hyperlinks, which you can follow to find more information about this topic and provide additional context. The main content of this section is visualized in this map here, showing a county by county breakdown of the number of users of the selected service, in this case, community-based adult services, per 100,000 Medi-Cal members. Provider locations shows an even more detailed map view, which identifies the various location types over here on the right-hand side that are available to residents of Sacramento County in this case, and shows where on the map they're located. The next section is respite services. Shows a very simple view. In this case, we've selected the Area Agency on Aging Planning Service Areas. It just shows the number of caregivers of people ages 60 and older who received respite services per 1,000 residents shown in, again, the blue bar for Sacramento. In this case, it is showing the planning service area number 4 compared to the statewide value. In this case, they happen to have the same value. Next section is adult day programs, which shows another county-based map of the adult day program facility maximum client capacity per 1,000 residents. Another similar section is home delivered meals. Another county breakdown showing meals per 1,000 residents, 60 and older. The section is the Department of Housing and Urban Development housing units. Shows again additional links for additional context. And the data here outlines per county how many subsidized units are available in this lighter color compared to the number of eligible renters in the darker shade of blue. And then we have 2 transportation sections. This first section is simply description text of the paratransit and nonprofit regional programs. And the final section is social service providers, specifically for transportation. And this shows the number of participants who use transportation supportive services per 1,000 residents. Again, the Sacramento value compared to the statewide value. So I know that was very quick and brief as a high-level overview of the tool, but now we can dig into a little bit more of the details, which demonstrate a little bit more of the functionality if we use an example scenario. So let's imagine we are a policymaker for the Area Agency on Aging. We want to understand the types of services available for older adults specifically in Mono County and Inyo County. Those are 2 rural counties in California. And this could be useful for a grant application or a needs assessment, for example. So if we wanted to look at Mono County and Inyo County specifically, we'll first start by changing the selected county from Sacramento to Inyo. And you'll note that the data automatically updates on the page. I'm going to start by going back up to the top to the age section. And here we can see that specifically for Inyo County, the 60 and older population is fairly high compared to the statewide value of 23%. Inyo has 35% who are 60 and older. Similarly, we could find more demographic breakdowns for Inyo County and Mono County in the race and ethnicity section and the spoken language section. But let's assume we want to see more data about the programs and services provided to this population specifically. So I'm going to jump to the Medi-Cal funded programs services section, which again shows this county map. And you may notice that the dark border has moved from Sacramento to Inyo County over here on the eastern edge of the state. And just to demonstrate that, if we switch to Mono County, you'll see that the outline shifts over to the adjacent county. This one is Mono County, the one below is Inyo County. Just identifies which county you've currently selected. And on this map, the gray shade of color indicates 0, as we can see on the legend here, or no services provided to the selected county. And in this case, the service that we've selected is community-based adult services. If we switch to multi-purpose senior services program, we'll see that the colors update, but for both Mono County here and Inyo County, the color remains gray. There's still no services provided to those 2 rural counties. Same is true if we toggle between all of these services, with the exception of in-home supportive services. Now, both Mono County here and Inyo County below have a shade of blue applied to them. They're quite light shades of blue, so that indicates that the rate of usage is still quite low compared to other counties, but they are provided this in-home supportive services. And if we hover over a specific county, let's hover over the selected one, in this case, Mono County, we can see the actual value, the actual number of users per 100,000 Medi-Cal members in Mono County is 976 compared to the statewide value, which is well above 5,000 users. And again, these are rural counties, so just as a counterpoint, if we hover over Los Angeles County, you can see that it has a value of 8,000, over 8,000 users per 100,000 members, which is higher than the statewide average. Next, let's scroll down to the provider location section, which again provides a more detailed view of these location types and where these provider locations are found. In this case, because we've selected Mono County, we can see that there are 4 highlighted location types in the legend over here, indicated that those are the types of locations that make services available to residents of Mono County. There are 5 additional location types in gray, or faded gray here, indicating that they are not available for residents of Mono County. And if we hover over one of these locations in the map, we're provided with additional detail. For example, in this dot here, it is an area agency on aging, and you can even see the exact address of this location. And if I switch to Inyo County, you'll see that a new location pops up here, indicating that this one is provided to Inyo County, even though it was not provided to Mono County. And you may notice that in the lower left-hand corner is identified as a Google map, and it functions just like any Google map that you might be used to using. So as described up here, if we want to zoom in, we can use Control plus Scroll. So I'll zoom in on the map a little bit, and you can see the additional details start to appear. Some smaller cities are now rendering on the map. And you'll also start to see streets, especially as you zoom in even closer, public transit, etc. So that's the location types. Let's take a look at respite services for these counties. Again, we're interested in the area agency on aging, which is already selected here, where we can see that the planning service area 16 has a higher number of caregivers compared to the statewide average. And finally, let's take a look at home delivered meals. This shows the number of meals per 1,000 residents 60 and older. And Inyo County here has a somewhat medium shade of blue, indicating that it does not have the most meals provided in the state per 1,000 residents, but it also doesn't have the least. And again, if we hover over the county, we can see the exact values. And one thing I should note about the area agency on aging data is that the data that's currently in the tool from fiscal year 2020, during the height of the COVID-19 pandemic, Mathematica recently received updated data from state fiscal year 2023 to 24. So we will be updating the tool with that newer data. And we plan to make further enhancements to the tool as well as we continue to roll those out throughout the year. It sounds like there may have been a question that I can answer. Let me take a look here. Sounds like there's a question about MSSP data. And it sounds like the data we're using for that is from 2021. And we may have opportunities to explore updating certain data elements as we proceed throughout the year.
Yeah, thank you so much, Chris. And we do actually, I think we'll take it, some questions now. So I'm glad you're looking at that because people may have questions about what we've already presented or on the digital tool. So please, if you have questions, put it in the Q&A and we will work to answer those. And if Chris already mentioned, this data is based on prior fiscal year data that was available. There will be opportunity to update it. You may see discrepancies because as the John in the comments pointed out, he has a new program that's in a new county maybe, and that might not be reflected here. But anything that you see that you think needs updating or that is not correct, we do encourage individuals to email HCBS Gap Analysis at aging.ca.gov.
I think there's also a raised hand, just FYI, Anna. So people can either raise their hand or type their question in the Q&A.
Excellent. We do have a question here about what other enhancements are planned. Chris, do you want to talk about some of those that you mentioned?
Let's see. Well, I don't know what I want to commit to today.
Well, let
Um,
me start by saying that we've started reviewing it. It's a brand new tool. This tool is not designed just to remind everyone to help people who need services navigate services. It's really designed for our policy people, our planners, for doing needs assessments. We're developing local plans where we need data in our local communities about the population, about what services are available. Is really how this tool is designed to be used. So we've just gotten a first look at this. We've been looking at it a little bit, but as it comes along, we take a look and then we think about how we can make it more user friendly and be able to utilize the data as effectively as possible. So we've been talking about just what kind of enhancements we can make to improve the usability of the tool.
I guess one specific example is that we plan to make the data that's displayed in these tables available for download in the future.
Excellent. And I'll also note that while the data, and you just toggled to it, Chris, but not only do you have the opportunity to look at the map with the different colors, but the table creates an additional level of accessibility and another way of viewing all the information that's in there. Sarah, do you see a hand up still? I do
Oops,
not.
I saw one from Liz Shorty earlier, but she, I think she might have lowered her hand. There also is a question about how will utilization of the tool be tracked?
It's a good question.
I don't think we've really thought through that. It's a good question.
We might have to come back to that question. It's possible we may be able to track the number of views of the tool, but I'm honestly not sure. So we'd have to look into that.
Excellent. And we'll take that question back. I see a question about accessibility of the tool. We do want your feedback. That's why we've created a table version so you don't have to rely on color contrast. But again, encourage you to email us or let us know if you run into any issues with that. But that has been at the top of mind throughout the development. And I think what we'll do now is go on to our reactor panel.
Wait, Anna, there's one
oh.
more question here. It says for larger counties like LA that has a heavy population or San Bernardino that is a large area, is there a smaller breakdown than just the county level? Chris.
We're not currently displaying a smaller breakdown with one minor exception of, in this case, we do have the city of Los Angeles that is distinct from the entire county. But one way to address these population differences that we've attempted to account for is by displaying these as rates. So this is meals per 1,000 residents rather than the actual total count of meals. So it should, in a way, account for the varying population numbers between counties. But yeah, again, we don't have a finer grain of detail for those numbers within the counties themselves, at least in this version.
Thank you, Chris. There was also a comment, if the person who made this comment wants to speak to it, please do so. But I think it's a really interesting point. It was a point of, do you intend to incorporate greatest economic and social need into this analysis? And that is one of the factors that area agencies on aging use in planning for their area plans. So if you want, whoever that was that had that question, if you wanted to expand a bit on that, just because it's good for us to hear what your thoughts are we can always take it all into consideration. Yes, Maren, I see your hand is raised. Okay, I just did it.
Bear with me. I'm
Hold on,
trying
I
to
got it.
get.
I was
Okay, thank you.
muted. Yeah, for the Older Americans Act and California also require that we, and you've already kind of got well, we look at poverty levels, greatest economic need, because those are targeted populations for us to serve. In addition to everyone else that's 60 and older. And then greatest social need includes a list of categories like race and ethnicity. It looks at LGBTQ groups. It also looks at rurality as people who are isolated. So it's actually listed in the Older Americans Act. And then also, so this is a wonderful thing. And so when we do our area plans, we have to go collect data wherever we can find it for our PSAs. So I just suggest that if that in the future that could be looked at as maybe being added.
Maren, thank you so much for that suggestion. I think, unfortunately, I wish our work with Mathematica could continue in perpetuity if resources weren't an issue. But as we do this last phase of work with that Mathematica, we'll think through that. But I'm also going to put in the chat a link to our county data fact sheets, because some of what you're talking about we have done through our data dashboard for aging. So I think you could use that in your planning for your planning purposes. So I will put that link up, but you could kind of use the two together. So this tool plus the county data fact sheets that we have put together. That's just a thought.
Well, thank you very much for your questions. So I will go on to introduce our reactor panel. So thank you so much, Chris, for the overview, and it's been a pleasure working with you and our continued work to finalize the digital tool.
Thank you for your time today.
So I would like to introduce our reactor panel. We have Hagar Dickbin, Director of the California Long-Term Services and Supports and Advocacy and Justice and Aging, and she is our co-chair for the Disability and Aging Community Living Advisory Committee. So I'd like to welcome Hagar. Also, I'd like to welcome Sherry Burns, Executive Director of Silicon Valley Independent Living Center, and also co-chair of the Disability and Aging Community Living Advisory Committee. And then finally, Michelle Rousey, Chair of our Transportation Subcommittee of the Disability and Aging Community Living Advisory Committee, or DACLAC. All three of these individuals have been very engaged, both on a local level, statewide level, and even national level, in ensuring that there's increased access to home and community-based services for older adults and people with disabilities, and addressing caregiver supports and needs. The DACLAC has also been a critical partner and stakeholder in the development of the non-Medi-Cal HCBS Gap Analysis. So I'm looking forward to hearing your reactions, feedback, and ideas around the non-Medi-Cal HCBS Gap Analysis. So with that, I'm going to start with you, Hagar, with a question. So Justice and Aging has prioritized the importance of ensuring access to home and community-based services for California's older adults and people with disabilities. So based on your analysis of the HCBS Gap Analysis, what do you see as the greatest need and opportunity?
I think what the gap analysis really shows for non-Medi-Cal programs, but also I think you see similar gaps in the Medi-Cal gap analysis the Department of Healthcare Services published a few months ago, is that the need is so great and across the board, whether it's gaps in services, accessible transportation, housing, or personal care services, or gaps based on geography, when you're looking at rural versus urban areas, and then disparities across demographic groups for LGBTQ individuals, people with limited English proficiency, and then our Black, Latino, and Native populations. as well as older adults who don't have family caregivers, and especially those with Alzheimer's and other dementias. The CDA data really is showing that it's the same people that are falling through the cracks across all of those systems, both through Medi-Cal and non-Medi-Cal. And even if the data is not complete or updated, and you just called that out as well, that the gap analysis report identifies what data we really need to have in order to have complete picture of the gaps, and that's really important. And we're definitely going to be pushing for timely and ongoing collection and analysis of that data. But even without it, you can see that CDA-funded programs that are supposed to really be filling the gaps for those people not accessing Medi-Cal services are not sufficient. And I think that makes sense because Older American Act funding and other funding streams are not really meant to be comprehensive. They're really kind of plugging holes, and they're not as comprehensive as Medi-Cal funds. I really think that calls attention to a need for more accessible and expansive Medi-Cal system that can catch more people. And I just talked about that an hour ago, so I won't go into it too much. But what really struck me is really the fact that the gap analysis is showing that the non-Medi-Cal system is exhibiting so many similar design issues that are causing and driving diverse disparities that are really similar to the same drivers of disparities in the Medi-Cal funded system. And our home and community-based services, whether they're delivered through Medi-Cal or through this vast web of funding streams, are varied and uncoordinated and confusing. So it's not a surprise that we're seeing significant disparities in both access and availability that are similar on both sides of the system. So as we're thinking about how we're going to close these gaps, the opportunity here is really to look at those drivers of gaps, and we've already identified them, like the patchwork nature of these programs, the high administrative burdens put on older adults due to lack of standardized and standardization and externalization of the system, geographic disparities in resources, and then shortfalls in cultural competent care. And then we need to make sure that when we invest in our HCBS systems, we build an infrastructure that can really close those gaps by addressing those system level drivers of disparity. So as we're continuing to make significant investments in home and community-based services, those investments need to be tied directly to removing those barriers that are, or those drivers of disparities, like replacing lack of coordination with a streamlined system, replacing a diffused with centralized system, and then thinking through those populations that are not receiving care. We need to ask what services or elements of services are missing. Like, what are the underlying assumptions in our system that are keeping people from having their unmet needs? And just for an example, our system really assumes that people have unpaid caregivers that are available to them, and that assumption leaves older adults who are aging on their own with no family members, and especially those with Alzheimer's or other dementias, at risk of going without care and facing harms associated with unmet needs, like injury and homelessness and unnecessary institutionalization. So part of addressing these gaps is calling out those assumptions and thinking through the system level needed changes that will start closing those gaps as well.
Thank you. Thank you, Hagar, for your thoughtful response. And Sherry, as the executive director at Silicon Valley Independent Living Center, you provide critical services that help people with disabilities, including older adults, maintain and achieve independence in the community, including accessing affordable housing. What thoughts do you have about the gap analysis findings related to affordable, accessible housing as it pertains to the growing population of older adults and people with disabilities who may be at risk or are facing homelessness?
Thank you, Anna. Well, actually, earlier this week, I heard a news report that Los Angeles County and Los Angeles City have actually seen a slight drop in the number of unhoused residents in the past 2 years. Unsheltered homelessness in LA County decreased 9.5% in 2025, while sheltered homelessness increased 8.5%. And in the city of LA, unsheltered homelessness decreased 7.9 or almost 8%, and sheltered homelessness increased 4.7%. Despite these hopeful gains, though, people continue to fall into homelessness faster than the rehousing system can move them out. And the number of older adults experiencing homelessness still continues to increase each year. with now 50% making up the unhoused population, the majority of whom have at least one disability. Of course, this lack of affordable housing, and more specifically, deeply affordable, accessible, and safe housing for older adults and persons with disabilities, isn't just an LA issue. It's a statewide problem, with some counties experiencing even greater gaps between unhoused older populations and available housing. We heard from CDA that by 2024, the population ages 60 and older is also expected to increase at a faster rate than the state average in certain counties. For example, the older adult population is projected to increase by more than 50% in Alameda, San Benito, and Santa Clara counties. Santa Clara County is the county that SVLC serves. The number of older adults with disabilities is also projected to increase the most in these three counties. And according to recent estimates, only 24 units are available and affordable for 100 extremely low income households throughout California. That means more than 75% of the people who need housing units the affordable housing units, they're not there for them. And even temporary sheltering programs aren't designed to accommodate this population. We know from our own experience, shelters are often not wheelchair accessible. Beds or cots are not designed for older and disabled adults. They often don't provide reasonable accommodations for those who need caregiver services or additional privacy, and they don't allow for emotional support animals. Many also do not have service providers who are culturally and linguistically competent to meet the needs of older adults and people with disabilities who identify as LGBTQ, Black, Hispanic, Native American, or multiracial. And you alluded to that earlier in your summary. The HCBS Gap Analysis also found that affordable housing providers struggle to link older adults and people with disabilities to a variety of supportive services, largely due to a lack of funding and coordination around these services. We find this in our own work that we do in providing housing support and case management to the people that we're serving in Santa Clara County. So not only do we have a much greater stock, we need a much greater stock of deeply affordable, accessible housing. We also need more coordination among the government and non-government programs that provide long-term services and supports, such as easy-to-use transportation systems, and I'm sure we will hear more from Michelle on that, affordable caregiver services, personal business and case management, health management, food access and nutrition support, and access to social engagement opportunities for all of these residents. Lastly, the gap analysis confirmed what disabled and older adult service providers have experienced for years. Throughout California, there are nearly 500,000 extremely low income and severely cost burdened renter households with at least one older adult person or a person with a disability. These renters are highly vulnerable to losing their current housing and becoming homeless, thereby adding to chronic homelessness across the state. In my opinion, in summary, the HCBS Gap Analysis suggests that, one, we need to assess how our range of government housing programs can more effectively coordinate their services, streamline cross-service access, and more quickly add to the stock of affordable, accessible housing that is targeted for these populations. Two, we need to find immediate ways to augment the incomes or reduce the rent costs of older adults and adults with disabilities who are on fixed incomes and have limited liquid assets so that they won't lose their long-term housing. And three, we need to better coordinate local and state services to support older adults and those with disabilities who can live in the community with needed long-term services, supports, and case management.
Thank you, Sherry. And thank you for all the work you do at the local level to find solutions and work with individuals to address these needs. Michelle, as chair of the Transportation Subcommittee of DACLAC, you play a key role in educating stakeholders and the state on the transportation needs of older adults and people with disabilities. What do you see as the most important challenges to address in California's transportation system?
Thank you. Yeah, well, hearing about the gap a lot across all services, it just makes me want to cry because we're aware of these gaps, but we need to be actively taking action to address them. And I think this is part of the way we do it by having this group and other groups address those gaps. Issues raised in the gap analysis reinforce issues that the DACLAC Transportation Subcommittee has been discussing. The lack of data about accessible transportation services, the cost to run the services, and the cost to make improvements is a huge barrier to change. And it's across a lot of different services. And like I said in the gap, if you've seen one county, you've seen one county. It's not addressing the individual needs of every county and the multitude of different transit services within those counties. The limits of paratransit are problems for a lot of people. The need to make reservations a long time in advance in a way that service usually stops at agency borders, the way services is tied to fixed route services transit system, result in services that are less convenient for people, seniors and people with disabilities. I'd kind of like to tell a story. In some of my work with my current paratransit agency that I do, I came across a story of somebody who moved from New York who had full paratransit door-to-door services and moved up in the hills of Oakland. But because her paratransit is fixed to the fixed route services, she's within 2 blocks of not having paratransit door to door and has to walk 2 blocks to make herself eligible for paratransit pickup and drop off. And that nearest bus also doesn't work on the weekend, so she has her and her husband have no paratransit on the weekend and limited service because they have to walk to make themselves be able to get the service. This is in the city. Just think of those paratransit and other riders who are in our rural areas who don't have these services and that access for similar reasons, if not more. The challenges with paratransit services, the lack of data, the importance of driver training, something that we've incorporated into East-based paratransit recently over the last year is disability awareness into our trainings for the drivers. And I think this would be something that could be done statewide. Coordinated transportation providers, we're losing them. We're losing some of them. And, we need to make sure that, if we have a needs assessment done again, that if we can push it to each county so that they get that information out back up to the state level so that the numbers and what the needs of the people are who are seniors and people with disabilities, those needs get looked at and met and have the numbers to back them up. We've been doing a lot in the transportation subcommittee, and I look forward to talking with you guys in the future more. Thank you.
Thank you very much, Michelle. And you do so much in this space around transportation, but just in general on disability access and services. And thank you for bringing the personal individual into your remarks and rooting us in the fact that, we need to make sure that our systems and our programs are actually responsive and to the individual's needs and actually meet real people's needs. So I really appreciate all your work that you do in this area. Do you have something else to add?
Can I say one more thing? Our ADA is limited, so limited. And I think a lot of people, because they don't utilize it, and think that, it's an ideal system. To me, it's not, because, that it's our ADA, but we're limiting the service because it's a fixed route and other things. We're not meeting the need. And, there's a lot of city-based programs and things like that, but we're still not meeting the need. And, when they do realignment of our fixed route and stuff like that, they know the numbers of who will be cut off of our paratransit, but it still gets realigned because we're about to hit a fiscal cliff with our transit across the state, and funding is not there. So all of that needs to be addressed. And when you do it for seniors and people with disabilities, you're doing it for everybody. So all these programs, if you're addressing them for our seniors and people with disabilities, you're addressing it for our future people who need them and for people who need them now. Thank you.
Thank you. So we're gonna thank you all three of you for your comments and the work that you do in this space. And I'm going to open it up to additional questions. If anyone has any questions, they can put it in the Q&A and we will work to answer them. So I'll just give a moment for people to ask any final questions before we wrap things up. And just as a reminder, the HCBS, non-Medi-Cal HCBS Gap Analysis has been posted to CDA's webpage. So please go there for the full report. Additional resources that may come out of this will be posted there as well. We also, the digital report also is available. And I think there was a link already put in there, and maybe we can put the link there so that you can go onto Mathematica's webpage and look at the digital report that was reviewed earlier. So please utilize the resources, provide feedback as we work through this project. And I see that I don't see any questions, so I think I will actually hand it over to you, Sarah.
Great. Well, thank you so much, Sherry, Michelle, and Hagar, and of course, Anna, to you as well, for your facilitation. And thank you to Chris for presenting the digital display. I am going to do high-level closing remarks on behalf of our director, Susan DeMorris, because she had to step away at the last minute. But just tremendously grateful for the support of Mathematica in carrying out this work. I think what is really important to recognize at this point is we're just getting started. I think what we've heard loud and clear today from our stakeholders and from the data in the gap analysis is that there are some very serious issues and challenges that we are halfway through our progress in implementing the master plan for aging, but we have a lot of work to do. And it has to be in partnership with all of you. We have to get continue to engage the legislature, the governor, all of our state partners as we do, and we have to double down and make our whole society aware of and committed to addressing these challenges. So I'm really proud of our partnerships and how we're aligning aging and disability. We can't get through all of this without those partnerships. So next steps, we've released the digital report. We will be putting it on we're really calling it a digital landscape that you can use for any planning purposes. That will be on our website. And then we're beginning our work on our multi-year roadmap that we're going to be seeking the input of our stakeholders in its development, and that will be released in the fall of 2026. And just please stay in touch, keep tracking our the work that is underway, and we rely on all of you for your input and feedback. So a big thank you to our team here at CDA that helped make this happen, and of course our partners at Mathematica. I hope everybody has a pleasant rest of the day, and we look forward to our next engagement. Wait, it looks like we have a question. Oh, we just have a thanks. Okay. Engagement with all of you. Thanks. Bye-bye.